Is the world ready to deal with spreading COVID-19 infections? World Health Organization experts warned this week that the world was simply not ready for a spike in COVID-19 cases. These were reported in South Korea and Japan, parts of Europe such as Italy, and in the Middle East countries, with Iran facing the biggest threat. In China, though, the rise in confirmed cases has slowed down in Wuhan, the epicenter. The rest of the country is starting to see the long-desired goal of 0 new confirmed cases. But with more people on the road and back to work, with the exact nature of outbreak yet to be determined, can China take a breather? Dr. Gauden Galea, the World Health Organization's representative to China, told me clearly in an exclusive interview Wednesday, all important measures have to go on. This is no time to relax.
The outbreak has changed dramatically. When we last spoke, the numbers of new cases that day were of the order of 2,000. We are now at a quarter of that level. In those days, we were discussing what did it mean as the epidemic started to decline. Now we see a continued trend since those days. And indeed, the numbers of cases being reported outside China are now beginning to be equivalent to the numbers inside China. It has shifted to 34 countries around the world, but at the same time, China has shown that there is a way of controlling and achieving a consistent decline. We are not over yet, and I'm sure we will have a chance to discuss this. There's no time for complacency, no time for declaring victory. We need to continue the work that is being done, but it is much better to be reporting on over 2 weeks of declining numbers.
If we think about the current situation, the number slows down in terms of increase rate. It has so much to do with what we did over the past 2 weeks and earlier, rather than what we are doing now, because the result of today will be reflected only 2 weeks from now.
Yes.
But look at today, Dr. Galea. People are coming back to work. There are much more people-to-people interactions. We also see shopping malls, streets, public parks, even scenic spots now have more people, if not crowds of people. What kind of warning signal does this send to you?
On one side, one does not want to cause panic. The epidemic is showing community transmission in Wuhan, and efforts are being made to control and mitigate the situation there to reduce the impact on families and the people affected, reduce the suffering, produce the best care and public health measures that is possible. Outside the country, all the evidence that we have seen points to clusters within households, and there's very active containment being done by very intensive case finding, very searches for people and testing of people with influenza-like illnesses so as to get a sense of whether there are community transmission. So for the time being, it appears that the transmission that is happening outside Hubei is more contained in people whose chains of transmission can be traced. So people do have, there is a lot of wisdom to seeking to restart the economy in a gradual fashion, to get schools back in play at some point, to get workers back to factories, having and offices. That is all understandable. People should not mistake that this return to some measure of normality and economic activity is saying, oh, we've won. The virus is still around. There's a huge imperative that people should keep protecting themselves, keep washing their hand hygiene, their social distancing. I think it is premature to be thinking of the same level of social and entertainment, for example, behaviors before the epidemic is clearly better under control, until we see an even lower level of decline. A gradual return to normality. We do know the vigilance is still there, and that each individual case, as it is discovered, will be very quickly isolated. We know that there are beds that have been put in surplus, in readiness, should there be another outbreak. But people should not be falsely reassured. That is a danger which can lead to some resurgence in the numbers.
Let's divide the issue between Wuhan and Hubei and the rest of China.
Yes.
Dr. Galea, there has been extremely strict social distancing policies implemented in the epicenter of Wuhan and in many parts of Hubei. However, we still see, after almost 1 month of those policies, the situation is better, but new cases, particularly in Wuhan, are still popping up. Whether social distancing is the best way to do. The reason I'm asking this is not because we can turn back the clock, but rather what China can do now, or has been doing, can be of reference to the rest of the world, which are still now experiencing the very early stage of an outbreak.
The WHO China joint mission has just ended its work, and they made it very clear as they went around and looked at the situation in different provinces, in Wuhan itself, in Beijing, in Sichuan and Guangdong, that there is no such thing as a single China approach. That there are different patterns of the epidemic, and in Wuhan itself there has been community transmission of the virus, and so this is a process that they have said publicly that with the process of the lockdown in Wuhan and the social distancing generally in China, hundreds of thousands of cases have been averted. The force of infection, the rate at which the number of cases was rising at the beginning was so fast that it would normally have taken much longer to reach the peak. So yes, of course, one can see the cases that there are now, but at the same time, these are demonstrably much lower than they would have been if measures were not so strictly put in place. When the members of the mission returned, they reported that as they visited a fever clinic, as they did not see any patients, that it was very important to keep, even for them, a distance and to have indirect visits. But they were able to hear reports from frontline workers that the numbers of cases have started to decline to a level where they can start to plan about how to provide care better. They can move patients. There are some open beds. Yeah. So there is, yes, the numbers increase, and Wuhan and Hubei are still the epicenter and still account for most of the new cases in China. But at the same time, there is a measure of control already appearing there.
But the question really is, Dr. Galea, how long can the social distancing policy, particularly very strict social distancing policy, be sustainable? There are other health consequences, as you may know, when you have people confined mainly at home. So, and not to mention psychological issues. Of course, saving lives is still the priority. People want their lives, so they still stay at home. But how long can this go? This is also a very crucial question now, because we have already seen budding symptoms of people who are suffering from other health consequences of this policy.
And already there, I could see both the cautious optimism, as I called it at the time, the strength of the frontline health workers, as well as the somber mood of the public health people as they were seriously understanding how rapidly this virus was spreading. That perspective still is very much alive with me now. Rather than understanding, I can only imagine what stresses people are under as they are isolated for a period of time. I can also understand how if people are still getting pregnant or still need antenatal care, people with diabetes and high blood pressure need to have their regular checks and to have their treatments. As the weeks grow longer, these stresses are surely there. One hears reports of alternatives being offered, such as virtual hospitals and internet-based services to appease some of those difficulties. But I can only say that we respect that sacrifice and we hope it will not be too long. What we have seen is that different policies are being implemented or relaxed based on a very strong scientific basis of risk assessment, looks at the declining numbers and can only hope that they will continue at such a rate that the pain will not be too long. But it would be very dangerous to try and make any prediction. It could set up false expectations.
While China is holding the front line against COVID-19, other places have to deal with a surge of cases there. How can they get prepared? Looking at the realities, prepare for the worst, to do it fast, make sure it is not just sporadic measures, but these are in-depth and get the whole society mobilized. Gauden Galea, the WHO representative to China, told me all of the above based on China's experience. These are measures other nations can learn from and certainly use as reference. Will the rest of the world, as we have witnessed, more likely to be resembling the cases of other parts of China, quote unquote, or the rest of the world could also see the danger that could resemble the situation of epicenter of COVID-19?
China has shown how to achieve a decline and a reduction in mortality and improvement in clinical outcomes. That has been now fairly amply demonstrated.
What are these, to you, the most important factors?
Being ready,
Okay.
Active case definition, active case finding, contact tracing, isolation. If there is any indication of clusters, you have to very aggressively go after the clusters. Any indication of community transmission will require broader containment measures, work stoppages of mass gatherings, stoppages of the school. Getting ready, getting the doctors and nurses, the healthcare workers to be already equipped and trained, high index of suspicion, to be actively testing people with influenza-like illness and severe acute respiratory illness, pneumonias of unknown cause or etiology, to be actively looking for the cases and the virus. With such levels of readiness and the willingness to activate an all-of-society approach, such as has been seen, that it is possible to build up a graduated system from the containment of a mini outbreak in a household to a more community-based approach. Also, to be ready not to be surprised, to increase the capacity within healthcare system, the extra beds that are going to be needed if there's a larger outbreak, the infection prevention and control procedures that need to be readied. These graduated risk-based approaches have been well demonstrated across the provinces of China. Indeed, we do not say that there is a China approach, but the China approach is, and these serve as good models for what other countries could do.
Now we see, Dr. Galea, that outbreaks are taking place already in South Korea, Iran, and Italy. Meanwhile, there are increasing concerns in Japan and also in even some of the continental European countries, and the United States, North America also, together with Canada, have some cases. The question really is, how much do we know about the strains, the virus strains, that were earlier discovered in Wuhan and other parts of China, vis-a-vis the virus strains in some of the other countries? Of course, they could also be different from one another. How much do we know about this so far, scientifically speaking?
In summary, people are being quite generous in uploading and sharing the genomes of many of these different viruses isolated from many of these different outbreaks. And as you look at the family tree, the phylogenetic tree, as it is called, of the viruses, up to now, all the ones that have been published all come from the same trunk. There's enough relationship between them to say that they are generally all referring back to the same source. We don't have, these outbreaks are not another disease completely, or a different strain, or a dramatically different strain of the virus. Yes, there are genetic differences that small changes are natural as the virus gets transmitted from one person to another, but the behavior, the sequences are all showing the common connection.
Dr. Galea, China now has already come to a certain stage of prevention, control, treatment, and many other things. But there is an increasing danger as other cases are developing, particularly in the neighborhood. How much of a danger of imported cases into China now, with South Korea, Japan, for example, and you never know how other international travelers would bring the potential of the danger. Dr. Galea, to you.
In a way, this is the same question as other countries were asking about China before, and it is answered in the same way. There has to be a risk-based approach, assessing what in the other countries, what is the pattern of transmission. Is it still cluster-based? Is it still traceable in terms of routes of transmission from, or the path of transmission from one person to another to a known case? Or is there community transmission? The same graduated approach needs to be followed in those countries as was followed in China. And China needs to continue its vigilance. There are many possible ways in which the virus could be resurgent. There are households in China that still have it. There's the community outbreak in its late stage in Wuhan. There are the possibility, as people return to work, of small resurgent numbers, and there is the possibility of reimportation. All of these remain a reality, The good thing is that in China we are now seeing a heightened sense of alert across the whole country, and the same applies, the same advice, active case finding and active contact tracing to limit the impact of any re-imports.